Hey guys, welcome back to my channel. So today we're gonna be talking about our products, our skincare products. Like how long will it take for it to start working? Like cleansers, acne cleansers, toners, moisturizers, serums, retinols, you name it. Okay, so I did a little research. Plus, I am applying what I have experienced to this whole situation that we're going to be talking about. So if you're interested to find out or interested to know based on my research and based on my experience, continue watching and don't forget to like, guys, and subscribe to my channel. And guys, take a look at my hair. My sister did it. I'm going to show you the back so you can see how it looks and so forth. Yeah, but this is what we're going to talk about today. Continue watching, like, subscribe, share, leave a comment, let me know what you think, and let's begin the video, okay? Okay, so let's talk first about the skin. Alright, how long does it take the skin to heal itself? For example, like the cell turnover. How long does it take for a cell to completely turn over as it relates to the skin, like healing and so forth? It actually takes 28 days for the skin to do a complete cell turnover. 28 days. So you know what that means. There's no quick results or easy results. You know what I'm saying? It takes a full 28 days. So if you want to use any of your skincare products, if you really want to see how effective they are, give them like a month. 28 days is good enough. Alright, so just keep that in mind. It takes 28 days for a cell to completely turn over, for full cell turnover. Okay, good. Alright, so the first thing that we're going to talk about now, we're going to talk about cleansers. How long will it take for you to recognize or identify whether or not your cleansers are actually working? First and foremost, immediately when you apply your cleanser to your face and after washing it off, you should know whether or not it is good for your skin. Because if a cleanser is too harsh in terms of whenever after you apply it and wash your face and so forth, if your face feels really tight, and you feel as though it is like harsh, just sensitive in general, then definitely that cleanser is not for you. It is too harsh for your skin. Okay, yeah, but in terms of overall results, it should take like a week minimum. It should take a week for you to recognize or identify if your cleanser is good for you. Okay, and then for like acne cleansers now or acne treatments like benzoyl peroxide and salicylic acid, they should take around 2 weeks to start seeing like changes in your skin. All right, and for the 2 weeks you're not going to really see, or actually in the first week you're going to experience, if you have severe acne or you know, yeah, you're going to see where like the bumps are supposed to like reduce in size. They're not going to like completely go away, but they're going to reduce in size after like a week. They should reduce in size, or they should experience, or you should experience some type of reduction in the size of the bumps, if that's what you are, you know, working on. And then like over 2 weeks now, it's going to slowly go down. They should go down. So yes, so you should see improvement in your skin after a week, 2 weeks, improvements. And for overall like a full improvement, full complete like results, like a month is good enough. As I said before, it takes 28 days for your cells to turn, or for a cell to turn over. Okay, yes, so that's it for cleansers and so forth. So if you want to know if your cleanser is good, your first wash should tell you if it's a good cleanser. And then after a week you can definitely know if your cleanser is doing a good job, especially if it's a acne medication, for example benzoyl peroxide or salicylic acid. All right, let me just talk about the benzoyl peroxide, because benzoyl peroxide is the type of ingredient that is going to dry out the skin. Okay, but you don't want a cleanser that is just geared towards drying out the skin and just killing the acne, because if the cleanser is just geared towards drying out the acne, and there are no like moisturizing agent or ingredient in it, then stay far away from that cleanser, because that cleanser is not going to do anything much to you but just dry out your skin. So we want to make sure that our cleanser, even if they have benzoyl peroxide in it, they should have some ingredient that is going to offer you some type of moisturization after applying that particular cleanser. Okay guys, so let's talk now about dark spots. How long does it take for dark spot treatments to work? It takes between 3 to 4 weeks. If your dark spots are just like maybe 1 or 2 dark spots, then you should experience improvement over that period of time. Sometimes it can take a little, it can improve earlier, but there are no guarantees. But usually it takes between 3 to 4 weeks. If you have excessive hyperpigmentation, it could take months and up to a year to actually see full improvement, because that is something that is affected by a lot of things. Like hyperpigmentation is caused from a lot of things. For example, sun exposure, sun sensitivity, hormone, inflammation, and all different type of skin ailment can actually cause hyperpigmentation. To get rid of it takes a long time, especially if it's a lot. You know what I'm saying? And if it's like internal, like hormonal problems and so forth, it can take a while. As you're getting older, you get hyperpigmentation. You know what I'm saying? So age could be a factor why your hyperpigmentation is there. So I can't really say like if you have hyperpigmentation per se, or dark spot from hyperpigmentation and so forth, or hyperpigmentation from dark spot and so forth, it's going to take 3 to 4 weeks to work. If you have severe hyperpigmentation, it may not take 3 to 4 weeks. It could take months and up to a year for it to actually work. Okay, but overall, for like dark spots or dark marks, they should take between 3 to 4 weeks. So after using a product for like 3 to 4 weeks, you should see some kind of improvement. It might not be like dramatic improvements, but it might be a good amount of improvement that you would want if you start to use, or if you start using a product that actually treats that particular problem. All right, so expect to see results after 3 to 4 weeks. There are some products that are like directly targeting hyperpigmentation because they actually kill the melanin. For example, hydroquinone. But I don't know, I've always been afraid of hydroquinone because I live in Jamaica, and you know, a lot of people, they're like doing a lot of skin bleaching and so forth, and it's always advertised that hydroquinone is actually not good for your skin and so forth. But I don't really know the science are involved with that particular ingredient, so I try to stay away from it, and I try to go with more safe ingredients. For example, alpha arbutin and so forth. You know what I'm saying? But if you want like a prescription based ingredient, or if you want an ingredient that's going to be really fast, I think that you have to like go to a doctor to get something prescribed, and I think those are a little bit stronger and they work a little bit faster, but a doctor's prescription. You know what I'm saying? Like not over the counter ingredients. Over the counter ingredients like alpha arbutin, vitamin C and so forth, they are going to take up to 3 months for you to actually see full results from using those particular products. And as I said before, you should start seeing improvement to your dark spots after 3 to 4 weeks, give or take. Okay, and if you have excessive hyperpigmentation, it can take longer. Okay, so hyperpigmentation and dark spots are really sensitive topics. I can't like tell you that tomorrow you're going to take it, it's going to take you 3 weeks for you to see real improvement to your skin, because the cells take 28 days to turn over. Okay, and sometimes the cells can turn over like after 28 days, but then it's not like fully, your hyperpigmentation is not fully gone. You have to wait another 28 days for it to turn over again. for you to really see changes on your skin. Okay, so really take that into consideration. If you really want fast results and you have serious problems, go to a doctor. They can give you the strong ingredients that's going to solve all your problems. Okay. But for over-the-counter products, they take 3 to 4 weeks, and for full results 3 to 4 months, or 3 months, give or take. Okay, nice. Okay, so let's look now at retinols. Retinols actually dark spot treatment. It's just retinol is retinol by itself. Okay, but retinols take between 4 to 6 weeks to work, and you know that retinol is going to help to basically like exfoliate the skin in a sense, or yes, exfoliating the skin and increasing cell turnover. So retinol is going to do that. Retinol is going to treat hyperpigmentation, dark spot, wrinkles, fine lines, and all of that. And over-the-counter retinols can take, for full results, as I said before, it can take like 3 to 4 months. Okay, and you should see improvements after 4 to 6 weeks. Okay, but for full results it can take up to 3 to 4 months. And as I said before, guys, remember the cells take 28 days to turn over. Oh, and also for retinols, the first part of using retinols, sometimes your skin can be flaky, irritated, and just sensitive. You understand? Because retinol is an ingredient that actually is doing something like excellent for your skin, or it's powerful. It's very potent. So after the first part of using retinol, it can be a little bit harsh on the skin, but over a period of time using it, then it will become more like used to the skin, and your skin will become less sensitive. Okay, but do like observe your skin when you're using retinols. Observe it to ensure that you know you're not doing too much to the skin. Okay, yes, so that's just for retinols. But if you want to try it, you can try it, because it's very good, especially when you're getting older in life and you want to, you know, have good skin or experience good skin, and you don't want to age too fast and so forth. Yes, so I'm going to slowly incorporate retinol into my routine, and the reason why I'm so scared to use it, because I know that like the first part of using it, it's going to be a little bit harsh on my skin, and I'm a little bit scared because I don't want my skin to be like, no, I don't want anything to happen to my skin right now, because I'm kind of really enjoying like what my skin is going, even though I may get a little bump, and I'm having a little problems right here, but like overall my skin is doing well, and I am a little bit scared to use retinol because I know that it's going to have a reaction, or people usually have a reaction to retinols after the first period of using it. Okay, so that's it for retinol. Alright, so the next thing that we're gonna talk about is eye creams. Eye creams, a lot of people are like, eye creams are not really necessary, but I like eye creams because the eye creams are just basically hydrating creams for the eyes, and some of them have really excellent ingredients, and you should experience or see changes to your eye area between 6 to 8 weeks, give or take 6 to 8 weeks, because the eyes, this area is very gentle, and we don't want to apply any ingredient that is going to work too aggressive, because this area is the eyes, under the eyes are very like thin and very gentle or sensitive, so we have to be careful what we're using. So I think that they formulate the eye products with hydrating ingredients that will work over 6 to 8 weeks. So your eye cream should work over 6 to 8 weeks. You should see improvement 6 to 8 weeks. If you don't see any improvement, don't worry, because eye creams are not supposed to be like miraculous. They're not supposed to really do anything, but they're just supposed to offer you some sort of hydration. And if you have like maybe darkness under the eyes, and you use like something that's going to work, like a serum, that should work. Okay, so your serums now, your regular serums that you use, just remember, if they're like if they have like brightening ingredients, remember what I said about hyperpigmentation and so forth. Your serum should fully work after 6 to 8 weeks. And I'm talking about the hyperpigmentation, the brightening serum, the moisturizing agent, overall 6 to 8 weeks. So give yourself a good 6 to 8 weeks for them to really start working. Alright, as it relates to moisturizers now, like hydrating moisturizers, not like acne medication, just moisturizing lotions, you should know if you want to continue using that product based on how it feels. If it's too heavy on the skin, if it feels like it's not doing any type of moisturization, if you wake up the next morning and you feel really dry, it means your moisturizer, it needs something else. It needs some more moisture in it. It's not enough to really moisturize your skin. If you feel dry after using it, get something else that's going to work for your dry skin. If you feel too oily after using your moisturizer, get something else that is not like oil based. That's more like water based, but it's still going to hydrate the skin. Alright, so just take those into consideration. Immediate results. Moisturization, immediate results. You should feel your skin being moisturized, and then over the course of a week you should feel your skin. It should feel moisturized. It shouldn't feel dry. It shouldn't feel, you know what I'm saying? Yes. And then over the course of maybe 6 to 8 weeks, you should see a fine or feel the difference in your skin. Your skin is supposed to be hydrated and so forth. You know what I'm saying? So that's for your moisturizer, if it's a hydrating moisturizer. Okay? Good. When it comes to like benzoyl peroxide and salicylic acid, remember that salicylic acid goes deep into the pores and it reduces the amount of oil that is in the pores. And now the benzoyl peroxide is actually an acne fighting ingredient, so it actually is fighting to kill the bacteria that causes acne. So those are acne fighting ingredients. You should see results after 2 weeks of using those. Okay, so just keep that in mind. You should see some result. Just any result is good results. You know what I'm saying? Any result is good result. Should be good result, I should say. So after 2 weeks of using any acne treatment, results should be there. However, after 2 weeks of using like salicylic acid or benzoyl peroxide, especially benzoyl peroxide, remember that sometimes using these products, because they're actually working, you can have a purge period. So maybe like in the second week, so the first week it's working and you just feel your skin feels different and the bumps are like, you know, they look different. Everything just looks different and feels different. But then maybe like in the second or third week, you might experience a purging period. And that purging period is the actual product working. So for example, we have like the acne fighting ingredient, and we have the acne fighting ingredient. You apply it to your skin. Basically what it is doing now, when you look, you might see that, you know, your skin, it just feels different. It just looks different. The acne, the bumps might not be so big anymore. They might look like reduced and so forth, but you still have that bacteria under your skin. You know what I'm saying? You still have that bacteria, and sometimes those bacteria, the bacteria that is in the skin or under the skin, they don't come up. They don't come up on the top of the surface of the skin yet. It is when you start applying the acne fighting ingredient, and the acne fighting ingredient starts to absorb into your skin, into your pores, and they start working after like 2 to 3 weeks. They're going to start pushing up, and when they start pushing up, they're going to come in the form of acne and bumps, and then you're going to see some bumps protruding and, you know, out of your skin, and you're going to realize, oh my gosh, is the product actually working? Is this working? Why am I having a breakout? It's not really a breakout, to be honest. It's actually the product working to push out the impurities so that your skin can actually heal. Okay, and then maybe after the 3rd week you have that little purging period. Then maybe like the 4th week everything starts to, you know, level out. And then the acne ingredient, acne fighting ingredients starts. If you're using salicylic acid, the salicylic acid starts to clean your pores, and if you're using the benzoyl peroxide, the benzoyl peroxide actually is trying to kill that bacteria. So you know, your skin is just starting to get clean, your pores are starting to get clean. And then what you have to do now is to use other products that will fight against like hyperpigmentation, it will fight against like texture and so forth, so your skin can actually heal. So after 28 days of a full cell turnover, you're gonna still have problems, so you need to wait another 28 days to deal with other problems. You know what I'm saying? So as I said before, for the overall results, it usually takes 6 weeks, give or take 28 days and maybe a week more, so 5 to 6 weeks you'll see full improvement to the skin. Okay, that's for acne medications. All right, so let's talk about spot treatment. A spot treatment is supposed to treat a particular spot like overnight. And as I said before, you have benzoyl peroxide spot treatment, and you have various spot treatments that actually work to treat a spot and an acne, like individual acne and so forth. Most of them usually work overnight, like not like overnight in terms of like a miracle, but overnight in terms of like reducing the size of the pimple, the blackhead, the whitehead or something. So overnight it should work to improve the skin. Okay guys, so yes, this is it for our video. Just use your products, be patient, and if you don't see any results after using it, then definitely try something else. Okay, so remember your cell takes 28 days to turn over. So after 28 days, if you give your products at least 1 month and it doesn't work, try something else. Okay, and as I said before, for like cleansers and so forth, you should know right at the get-go, like 1 week after using it for 1 week, you should know or try to figure out whether or not you want to continue using that. If they have salicylic acid, benzoyl peroxide, they should be working. They should take at least 2 weeks to start working, to start drying up the acne that causes the bacteria that causes acne. Okay, it's supposed to dry up clean your pores, clean all the oils, and then the benzoyl peroxide, if you're using it, it should be drying up the acne. And as I said, 2 weeks is enough to figure out if your cleanser is good. And as I said before, if you start using your cleanser, you should see or feel improvements to your skin. So yes guys, this is it. Hope you enjoy this video, hope you learned something, or yeah, so let me know what you think. See you in the next one. Bye bye.